Dr. Andy Rosenfarb here with advanced home strategies for your alternating current stimulation, your microcurrent ACS 3000. So a lot of you guys have purchased the 1.0 ACS 3000, and a lot of you have actually purchased the 2.0 model. So these applications are going to be useful for both of these. Now, a lot of you have been using the ACS probably for a few years, and some of you are new to using the ACS. What I want to share with you inside this video and this training is a new understanding of how to use and apply the ACS treatment at home. Now, these have been more clinical strategies that I've been using in clinic with patients, but I want to take this opportunity to help educate you so that you can implement these more advanced strategies of using ACS for home treatment as it relates specifically to your eye condition. So what does that mean? I'm going to unpack that right now. So again, whether you're using the 1.0 model or the 2.0 model does not matter, right? The important thing is you got your pads here. Again, with the pads, whether you're using saline solution, that's fine. You can use distilled water. You can use spring water. Just don't use tap water. Okay, tap water has the minerals. They will start to clog up the pads, and your discs will break down sooner than later. Eventually, the gray discs will need replacing, but for right now, we want to make sure that they don't build up with minerals. Okay, so here's how it works. So there are 4 primary placements, okay? You're probably familiar with the first one, which is directly over your eyes, all right? That is our standard protocol. But there are 3 other protocols. There's actually 4 protocols, but 3 we're going to get into today. The second is to go above your eyes, right? This is traditionally the original protocols that were used in Germany, right? The transorbital TOS, the RT-TOS treatments were placed over the forehead, okay? And we're going to talk about that and what that means in a minute. The second placement is your temples, right? Kind of in the temporal area. And the third placement is going to be below your eyes, right? So up, side, below, or right on the eyes. Now that you understand those 3 placements, how and why would we use each of these placements for different conditions? You guys are really smart. I'm glad you asked. So over the eyes, let's do the first one, right? Over the eyes is going to be specifically for retinal and macular issues and also bioenergetics. This is going to help with ATP production, to help the cells produce more energy for repair and regeneration. The core use for over the eyes are retinal issues, all retinal issues, whether it's retinal occlusion, CRVO, BRVO, BRAO, CRAO, any of the eye strokes, okay, that are in the retina. Any retinopathies, diabetic retinopathy, RP, Usher's, birdshot, any condition that affects the retina. Also maculopathies, macular degeneration, macular puckers, right? Epiretinal membranes, macular holes, macular dystrophy, myopic degeneration. So anything that's Stargardt's, anything that's affecting the cone cells, right, of the macula. So again, retina, rods, cones, glial cells, anything that's affecting the retina, your primary treatment is going to be over the eyes. Okay, this really impacts the photoreceptors. That's what we're targeting with over the eyes. Number 2, above the eyes, right? We're going to take the placement and put them above the eyes. This is going to really focus a little bit more strategically on the optic nerve, all right? So people are dealing with NAION, optic nerve atrophy, glaucoma, so on and so forth. So any of the frontal network that's really dealing with optic nerve issues, these are eye strokes, optic neuritis, optic nerve atrophy. Core use is people with visual field deficiencies. So again, peripheral vision loss, or if you start to see deficiencies in your peripheral vision, your night vision, this is going to help with that. Now, of course, when you're doing over the eyes for retinal issues, you're also going to be stimulating the rod cells, which are going to help with your night vision as well. But above the eyes, again, think optic nerve injury, visual fields, ischemia, eye strokes, nay ion, okay? And so that's number 2, above the eyes. Number 3 is your temples, all right? So we're going to put it in our temples. And again, with that, we're going to also be focusing on the optic nerve, okay? But also the vascular structures of the choroid and the blood vessels, the circulation to the eye, okay? Because you have a lot of nerve structures over there that we're going to get into a little bit later. We're going to do a very deep dive for you guys. For those of you guys who are interested, I'm going to put together a live Zoom training for anybody who wants to come in. We'll do this over about an hour. So this is going to be for those of you guys who are at home using the ACS. This is going to be a free training for you guys. We'll record it. But this is just kind of like a preview, quick start to get you guys started. So again, temple area. Think optic nerve, vascular, also the cortex of the brain, right? So this is where we're going to do some brain stimulation. Remember, the brain sees, and every treatment we do, we are affecting the brain. Tight muscles around the temples will always cause eye issues, all right? So this is going to partially help with the vascular system, the cortex, the optic nerve, but it's also going to loosen up and relax your temple muscles, which are very, very common for a whole host of different conditions. So think again, glaucoma, optic neuropathy, visual field regulation, circulation, stuff like that with the temples. Now, last placement below the eyes, okay, so we're going to put it right about here. Think drainage. So obviously this is going to be good for glaucoma too. The aqueous drainage, dry eyes, anything where there are clogged tear ducts, autonomic issues, right? Where the autonomic nervous system, where there's autonomic issues, stress, dry eyes, stuff like that. Ocular surface issues, as well as over the eyes for things like dry eye, meibomian gland dysfunction, are also going to be helpful. Why? Because lymphatics will drain in this lower placement. We're helping lymphatic drainage, right? So again, this is going to be particularly beneficial for eye pressure. So if you're really trying to use the ACS 3000 strategically to lower your eye pressure, this is going to help with that. This is also going to be a little bit more effective for inflammation. If we know that you have a condition, your ocular condition, where we've identified that there is inflammation going on, we want to make use of the lower pads over the lower parts of the eyes, suborbital. And also dry eye. This is going to be very helpful for people dealing with dry eye, whether that's your primary issue or it's part of anything you go on. Now, that we have all of those 4 placements together, what I want you guys to do is go back in this video or take some notes and write down which one is more specific for you. Again, over the eyes, I recommend pretty much for everybody. But what we want to do is we want to rotate these placements. Okay, some of you guys are doing once a day, some of you guys are doing twice a day. That's fine. If you're doing it once a day, just one day here over the eyes, maybe one day above the eyes, maybe one day in the temples, maybe one day below the eyes, so you can move them around. Also, if you're dealing with one eye, like an issue with just one eye, you can do over the eye, side of the eye, over the eye, top of the eye. You can do above and below. You can do here and here. So you can move around and just treat that one eye periodically. I do recommend you treat both eyes because eventually, even though it's one eye, it's a systemic issue, right? These are not just eye issues, there's a systemic. So we're going to need to treat the whole visual system, which means both eyes. So I want you doing some work on both eyes. I want you to move your placement out. And guys, keep in mind that this is for your specific use, meaning that you need to play around with this a little bit. There, of course, these are these protocols, but intuitively feel what works better for you, and it may take a little time to figure that out. So be patient, take notes, record, see what works better for you. And the last thing I want to talk about is why these placements work. Okay? Why do these placements work? Really important to understand the mechanism. So microcurrent, when we're doing pad placement, I want you to just consider that you're not just placing pads, all right? What we're really doing, and this is really important, so pay attention, we're accessing functional gateways to the visual system. These are all different gates. Think of it that way, where you're accessing different functional gateways. So it's important that you understand that. And as we do that, each of these zones which we kind of call them zone. And I'm going to get a little bit more specific with this. We're going to put together a little more training for you. But again, I just wanted to launch this out so that you guys have a better understanding. So these zones cover the cranial nerve points. They cover the orbital vascular gateways. They cover the dural fascial convergent points, right? And it means basically we're stimulating the following: the mitochondrial signaling, the ATP and calcium flux. We're stimulating the cranial nerve in terms of that excitability, optic nerve, any of the cranial nerves. Optic nerve is obviously the most important for you guys. Neurovascular coupling, very, very important. So the neuro-nerve vascular blood vessels, that system needs to be adjusted and coordinated, as well as fluid dynamics in the orbit, right? High eye pressure, dry eye, too much pressure, too low pressure, too much tearing, too little tearing, too much aqueous. That's going to raise the eye pressure. And finally, the entire visual system of the retino-thalamo-cortical organization, retinal, thalamo-thalamus, cortico-brain, right? So it's this transfer of information from the eye through the optic nerve to the brain to the visual cortex, so that we're aligning very cleanly and optimizing these signal pathways to as a multi-phase eye-brain healing model. All right, again, reminder, we're not just treating your eyes. For this type of therapy is a whole toning and tuning of the entire visual system. I hope this training was useful for you. If you have any questions, please reach out. Let us know. If you're interested in our remote clinic experience, please reach out to us about that. And if you're interested in coming to visit us at clinic here, reach out. We'll tell you more about our programs. Dr. Andy with Your Vision is Our Mission. We'll see you soon. Take care.